If you have the bacteria from the mouth entering the bloodstream on a regular basis because you're not brushing, it can have a serious impact on your cardiac health. So oral health is a really important part of general health, but it's very easy to actually do the day-to-day practice for oral health.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Eamon Keogh, and on this episode we are talking about dental health. With so many messages coming at us from brushing, flossing, rinsing, not to mention the different products being pitched at us, today we'll cover practical tips to help you and your children have a healthy smile, prevent decay, and avoid the need for fillings. We will also discuss the EU's decision to phase out dental amalgam from January 1st, a filling material containing mercury. We'll explain what this change means for patients and explore the safe and effective alternatives available. Joining me to talk through all this is Dr. Anne O'Neill, the HSE's Oral Health Lead. You're very welcome.
Delighted to be here.
So Anne, we might start with a simple but really important question. What is the correct way to brush your teeth?
Okay, we'll start with choose your toothbrush.
Yeah.
Most toothbrushes are chosen because of the size they are. So they should be no bigger than 2 or 3 of your lower front teeth because you want that toothbrush to be able to travel around your mouth easily. You choose the bristles. Most people will now choose a relatively soft toothbrush because what you want is that tooth to be able to sit on the gap between your tooth and your gum and to be able to move around in little circles to brush away food. You don't want it to be so hard that it's going to cause trauma, but you don't want it to be so soft that it's not going to do the work you need it to do. And then you have the option of selecting either a manual toothbrush where you have to do all of the movement and work, or you can use a motorized one where you've got a battery in it and the head of the toothbrush has some movement because it's motorized that lets you get around the mouth. You're trying to put that toothbrush where your tooth and gum meet because that's where plaque tends to accumulate.
Yeah.
And you're going to move it in little circles so that you're disturbing that plaque and then you're going to swish it away. The other thing that I say to people is think about your teeth as having 3 different surfaces.
Okay.
So you've got the outside, which is the cheeks.
Yeah.
The ones that face the cheeks and lips. You've got the inside, which is the side around the palate and the tongue. And then you've got the biting surfaces.
Yeah.
So pick your favourite corner.
Yeah.
And then start at your favourite tooth, whether you start in the middle, in the front, or you start in one of the back corners and then go around all of that surface. So you're going to start, my favourite corner is bottom left. So I start bottom left and I go around all the outside of the bottom ones, then go to the top ones and do it in a circle. Then I do the same thing on the inside and then I do the biting surfaces so I don't miss any of them.
Okay. And how long should you brush for?
It usually takes 2.5 minutes if you're really doing it methodically and not missing anything. And you do need to take it at that pace so that you're actually making sure that you get into any of those difficult little corners because most people will have a place that's harder to reach. So it's about 2.5 minutes. Pick a song, sing or hum along your favourite song or put a timer on your phone. Most people will have a phone available to them and put a timer on so that you're actually meeting that length of time.
Okay. And sometimes dentists give you those little things, don't they?
Sometimes you'll get a little egg timer. They're very old-fashioned, but they're very good, particularly for kids because they can actually see the sand going down.
Yeah.
You can get bigger ones in various different shops. But a way of actually making sure that you're spending the time doing it. So whether it is that you're going tooth by tooth and counting them all, or whether you're using a timer, it's taking your time to brush each of those surfaces on every single tooth.
Okay. I like the idea of the song, actually, as you were saying, particularly for kids, because it's an easy one to remember. And how often should you brush your teeth?
We have very strong evidence to say that if you brush your teeth twice a day with a fluoride toothpaste, you are going to have a positive effect on reducing your risk of dental decay.
Okay.
So twice a day is the key.
Okay. Can you brush your teeth too many times?
Well, most dentists dislike saying to somebody you're brushing too often.
Yeah.
Toothpaste does have an abrasive in it. It is designed to actually remove the dirt from teeth, so it has a little bit of abrasive in it. But the only patients that I've seen doing damage with toothbrushing are those that we call scrubbers. They will do that damage because they are putting too much pressure on the brush, so it's not about the number of times they're brushing. Some patients will be recommended because of their specific risk issues, whether it's a health risk or they've got appliances in their mouths or they've got difficult gums, whatever, they may get specific advice to brush 3 times a day. So it is important to actually get that type of advice from your dentist and follow it. But 2 times a day is the minimum, and there's nothing wrong with brushing after lunch, particularly if you're going into a meeting and you've had something that's sitting around your mouth and you want to go in with that fresh mouth feeling. There's nothing wrong with brushing an extra time a day, but 2 is the minimum.
And it's morning and evening before you go to bed.
The really important one is bedtime.
Right.
One of the hardest times of the day because you're tired, and if you're trying to help children, they're tired. They may be looking forward to going to bed, so they don't want to go into the bathroom and brush their teeth, or they'd rather be doing something else. So you're trying to build those good bedtime habits. And the reason for it, and I think if people understand why nighttime is so important, it's easier to build in the habit. The reason it's so important is that at night, your mouth doesn't move, you're not licking the surfaces of your teeth, you're not drinking water. So anything that's around your teeth is staying around your teeth.
Okay.
And for a lot of people, they breathe through their mouth through different times of the night, so your mouth dries. So anything that's there gets really tied onto teeth. And that's where the bacteria in your mouth will have an opportunity then to do damage.
Okay. Actually, one thing that surprised me in just researching for this conversation today was that you shouldn't rinse your mouth with water after brushing your teeth.
Yeah. Well, when you think about what you're trying to do with a toothpaste, because most people will brush their teeth with a toothpaste. It's designed to help remove that plaque.
Yeah.
Most toothpaste will have a key ingredient that you're trying to apply to your teeth as well. The vast majority of them, it's fluoride because you're trying to remineralize the enamel, make hard enamel so that it protects against decay. Some toothpastes are about gum health, so you'll have things like chlorhexidine in them that's trying to reduce the bacterial impact. But you're spending your time and your money putting a toothpaste with a key ingredient on it. And then if you rinse directly afterwards, you're washing all of that ingredient away. The ingredient needs to be against your teeth or your gums to do its vital work. Now, ideally at nighttime, you would actually leave it and get straight into bed and off to sleep. So you're giving that key ingredient time to work. And you've spent your money on your toothpaste to do that work for you. So it's important that you give it the opportunity to do that.
Okay, very good. You mentioned there about just bristles and the type of brush to buy. I just wanted to talk a little bit more about that because I'm very conscious of, I suppose, the amount of money companies spend promoting products such as electric toothbrushes and all the other instruments that you can get to clean your teeth. But could we just talk a little bit more about that?
There's a big marketplace for toothbrushes. There's a big marketplace for toothpastes, and there will always be a new product or a new adaptation of a product that's coming out, because that's how companies make their money. And that's fine, because we do need to have variety in the marketplace so that you can find the toothbrush that suits you. Manual toothbrushes can do the work, but they take more effort.
Right.
Electric toothbrushes come in 2 different styles. So you've got what's known as the oscillating one. So that tends to have a head that goes around, or you can have the sonic one where it's actually doing vibrations, so that it's actually the vibrations of the head that are actually doing the work.
Yeah.
It's important that people choose what suits them. You don't have to spend a huge amount in order to have a toothbrush that will do the work.
Okay.
Some people will need to have a look at the handle size, because if you're somebody whose hands aren't working as well as others, you may find that a slightly wider grip or a bigger handle actually suits you. And most people will find a head size and a bristle softness that is comfortable for them.
Okay. So it's about the comfort aspect.
So if I had 20 different hygienists, because they specialise in hygiene, if I have 20 of them in the room, they will all have a conversation, and you will find variation in what they'll recommend or what they'll suggest to people. But the important thing is that you're comfortable with your toothbrush and it's doing the work for you, and you're able to get into all of the different corners of your mouth. If you're somebody who's wearing orthodontic appliances or has an implant or crown and bridge work, you will get a recommendation of other instruments and tools that will help you clean around those. And they will have additional cleaning needs with different shaped tools and brushes that help you get the plaque around those ones. But in general, it's about a toothbrush that you're comfortable to use and you can get into all of the corners.
Okay. So we have our toothbrush, we're
You have your
comfortable with
toothbrush.
that. And then just moving on to toothpaste, because again, when you go into the supermarket and you're flooded with...
It's the wall of toothpaste.
Yes, exactly.
Absolutely.
And then there's different offers and then different things to make your teeth whiter. Is there a perfect toothpaste?
I haven't found my perfect toothpaste yet. And I would be a bit of a connoisseur of the wall of toothpaste. And I have been known to go to foreign supermarkets and see what they have that I don't.
Yeah.
There isn't such a thing as a perfect toothpaste. Coming back to what I said before, it's about a toothpaste that's doing a body of work for you.
Yeah.
So whether it is, I need something to help me prevent decay because I'm at risk of decay, or I need something to help manage my gum health because I'm prone to gum disease, or for some of our patients with sensory disabilities, they will find that a foaming toothpaste, the ones that really foam up and feel great around the mouth, they really don't like that feeling. So we have non-foaming toothpastes for them. So it depends on what you're asking that toothpaste to do. The vast majority of toothpastes are about a carrier of something like fluoride.
Okay.
And depending on your risk, fluoride is related to preventing decay. Yeah. So depending on your risk of decay and whether or not you've had to have fillings or whether your dentist says because of your general health, you really need to keep an eye on this, you might be recommended a toothpaste with different levels of fluoride. You can then choose from a variety of toothpastes that have those levels of fluoride and a variety of flavours, because the flavour range has expanded hugely in the past 2 to 3 years. So there's a toothpaste out there for everybody, without a doubt, at a price point that they can afford.
Yeah. And I wonder, even for children, because now, you see ones that are watermelon flavour and all this, and you're kind of going, how did they get that flavour? Are you better sticking with just a standard
I think
one?
the classic one is mint, because you feel the fresh mouth flavour. But for some children, those high mints are actually not very palatable, and they will prefer the bubblegum flavour or the watermelon flavour. I've tried some of them. They're not to my taste buds, I have to say. I go back to a mint. And I like a fairly sharp mint as well. Yeah. Whereas there are softer mints and things like that. There's a flavour there for everybody as well. But it is about finding something that is affordable. You only need a pea-size amount. It's about applying it to your teeth. Yeah. And then leaving it sit. So you don't need a huge amount. There is a product in the marketplace for everybody at a price point they like.
So, Anne, what about flossing? Is that always necessary?
When you think about what flossing's trying to do, it's trying to clean the surface that is your tooth meeting your other tooth. Yeah. So your toothbrush isn't going to get in there. And flossing is about gum health. So it is important. And for somebody who is prone to gum disease, it is extremely important. It is a challenge. Don't get me wrong. All of us who are flossing have the challenge of learning how to do it and trying to reach into those corners. But there's a lot of flossing tools that make it easier. And for some people who have slightly wider gaps between teeth, you can get single tufted brushes that will help you do that. Flossing is important because what you're doing is you're introducing a cleaning tape or floss. You're putting it down between the teeth. You're bringing it right down to where the tooth meets the gum. And then the best description I have for it is you're shimmying it up along the tooth so that it's disturbing that plaque. And then you're going down to the same space again around the other tooth and shimmying it back up again. Originally, floss was the little container of floss that you were trying to wrap around your fingers and cutting off the circulation and all sorts of stuff. And that's why people kind of go, oh no, flossing. But there are flossing tools out there now that make it much more convenient and much easier for you to reach into those areas. Yeah. And as I said, there's also interdental brushes that allow you to use a brush shape to get into that space. Yeah. And that's what you're actually trying to do.
Yeah. I think they're great, actually.
Yeah. But it's really important that those who need to floss are actually doing it on a regular basis, taking their time to do it.
Should you floss your teeth every time you brush, or it just depends on?
It's trying to find a quiet time that you can actually do it. For most people, they'll get specific instructions as to whether or not they're to floss twice a day. If you're very high risk for gum disease, you may be asked to floss twice a day because of your particular needs. But if you're balancing your brushing and you're flossing, probably nighttime is probably the easiest time for people to have time to do it and to be able to picture in the mirror and to work it into all of those corners, then that's the important thing, is that you're doing it effectively.
Okay. And what about if you see a little bit of blood, or, the way sometimes if you floss maybe too hard, what does that mean?
There's 2 reasons you'll see blood on floss. Number one is that you've been trying to introduce that floss very gently, and at the last minute you've gone boof. Right. And you've actually traumatized the gum a little bit. Okay. Or you haven't been as rigorous in your flossing. And when you introduce it, you're getting a little bit of blood reaction. And you can get that as well on your toothbrush when you're brushing. If you haven't been as effective the last few days, most times it's called gingivitis. It's a little bit of inflammation around the top of the gum. And as long as you clean it effectively over the next few days, that will actually resolve.
Okay.
If you're somebody who is more prone to gum disease and you see blood on the floss and it's not going away, or if you're somebody who's brushing and you're continuously seeing blood on the brush, then you need to get your dentist's advice, because there are some other diseases and processes where you will see bleeding gums.
Okay.
Vast majority of bleeding gums are about, I left food behind and I didn't brush well.
Okay. Actually, that's something as well. I think sometimes we tend to ignore symptoms, pass it off that, oh, it's just my mouth, or, it'll pass. Whereas if you get a pain in your chest or something, you might take it more seriously. But there is links between good oral health and other diseases, isn't there, such as chronic disease?
There is, absolutely. Some diseases, you will see the effects of the disease in the mouth. And the converse is also true, that oral health can actually impact on your general health. We haven't always explored that relationship. We've tend to take general health as being general health, and your oral health tends to be about just the dentist.
Yeah.
There's two types of tissues in your mouth. You've got your hard ones, which is teeth, the common ones, and then the bone supporting the teeth. But you have an awful lot of soft tissue. And that is where you will often see your general health being displayed.
Yeah.
So that if you're somebody who's anemic, or if you're somebody who has diabetes, you will see the oral impact of that in your mouth as well. I just mentioned diabetes, really important in diabetics. If you're somebody who has a chronic progressive illness like multiple sclerosis or Parkinson's disease, because of the progressive nature, you will get to the stage where you will need assistance in brushing your teeth. So it's really important that you're building good oral health at the start of that progression, so that it can be supported then with the assistance of somebody else. And there are inherited disorders that have a huge impact on oral health. So if you're somebody who has a cardiac issue, whether it is an acquired one or something you inherited, if you have the bacteria from the mouth entering the bloodstream on a regular basis because you're not brushing, it can have a serious impact on your cardiac health. So oral health is a really important part of general health, but it's very easy to actually do the day-to-day practice for oral health. It's about the toothbrushing, and it's about the flossing, and it's about preventing decay. They're the common diseases that we're looking for.
I mean, you have two very important points there. I think you mentioned around just that the mouth is a route into your body, really. Yeah. So, it is another way. If you don't brush, you don't maintain good oral health.
And that's being understood much more when people are talking to their general practitioners or the specialists about their general health.
Yeah.
That link of oral health and how not looking after your mouth can impact on how well we manage that disease.
Yeah.
That's being understood and discussed an awful lot more as part of that general health management.
Yeah. And then the other piece you mentioned there, just about the prevention. We talk a lot in health and well-being about prevention and eating the right foods and maintaining a healthy weight. But that prevention around your oral health is so important in your dental health as well, isn't it? It's like a stitch in time, really, isn't it?
It's hugely important, because if you think about your teeth, they're really interesting structurally, and I won't bore you because that's the kind of thing that dentists actually go off into rooms and discuss for hours. But they're really interesting structures. But once you damage them, if you break them or if you have decay that softens them, they don't regrow. So unlike bones, which are hard structures, if you break a bone, you position it together, the bone will heal. You might have some residual difficulties with it, but generally speaking, they recover and off they go. Teeth don't behave like that. So that's why prevention is really important for teeth, to manage and hold your smile and hold what one person calls your dental capital, as much tooth surface and as many teeth as you can, because they are designed to last a lifetime. And prevention for that is about doing the daily bits and pieces. It's about the toothbrushing. It's about making sure that you're removing food and making good food choices. And it might be easier to put that into practice than, say, trying to get 10,000 steps in.
Yeah.
Or trying to do some of those bigger preventive pieces that are quite disruptive to your daily habits. Whereas brushing your teeth twice a day is small pieces of time that you can actually include without too much disruption.
Yeah.
Once you build the habit.
And again, I suppose going to the dentist if you do have a problem rather than putting it off.
We try to get people to go to the dentist before they have a problem. That's really where your prevention piece really works.
Yeah.
Is where you're building a relationship with your dentist on a regular basis so that you're going to them, they're identifying problems early, and they're giving you solutions to those problems that are smaller and, let's face it, less expensive in most cases. And that prevention, early intervention is a real key to minding your dental capital and having it through life. The difficulty with oral diseases is that by the time the person recognises them themselves, they have travelled quite a way through the disease progression. So if you're having a toothache, that decay has travelled quite a long time and quite a way into its disease progression, and your options for what you can do with it are much more limited. With gum disease, is if you notice and you don't intervene with the bleeding gums that don't resolve, then you can have quite a lot of damage to the supporting structures of your tooth. And your tooth, once it becomes mobile, if it starts getting a little bit loose, it's very hard to actually get that to recover. So that positive relationship with regular attendance, early intervention and early solutions is a really important mindset and health practice that we would actually ask people to try and get into.
Okay. Is there a time frame so you should go to the dentist every year, or?
Most people in most systems would suggest that you go once a year. Now, for some people who are very good at minding their health, they may be okay to go once every 2 years, but that's a conversation to have with your dentist on your particular assessment. You will have some patients who are recommended, because of their risk rating for the common diseases, that they may be told you need to come in every 6 months. But it's about that early intervention, knowing what your risk is and knowing what needs to be monitored. That should dictate how often you go to the dentist. And if you're somebody who has a lot of plaque that builds up, most people will go twice a year to get that cleaned off so that they can maintain those positive gum habits. But the vast majority of people, once a year is enough.
And I just wanted to move on now. I'm conscious that we said we'd talk about parents as well and parents' role in helping their kids brush their teeth properly. I mean, how can parents encourage and supervise good brushing?
Parenting as a parent is one of the hardest jobs in the universe. So it's in that context.
Yeah.
It's about building from the smallest age. It's about building in the common daily time to do those small oral health habits. It's encouraging them from the time teeth start to appear that these teeth need to be brushed. For the smallies, for the under twos, it is about you brushing the teeth for them. As they get more independent, and knowing the kids that I know, some of that independence starts very young indeed. It's allowing them to have a go brushing their teeth, but you finish the brushing for them so that you're making sure that things are brushed properly. And then as they get older, allowing them to brush, but you checking that things are clean. With the teenagers, it is actually making sure that they're brushing, because at that stage when they're tired or they want to be doing something else, they will find ways of persuading you, as they do with most other things in life, that they've done what they should be doing, and it's about checking on them. For most of the kids, up to 6th class nearly, we would encourage parents to actually be in the bathroom when they're brushing. Or if it is somebody who really needs additional help, it's trying to find a quiet place, their favourite song, a position that they're comfortable in doing, and then actually doing toothbrushing, so that it's not something that you're trying to force into a very busy or fractious child moment. That is actually part of your getting towards bedtime piece. Once that has become a habit, once it's the thing they do last thing at night, it's easier for them to continue doing it. You'll see it with kids who have braces, because they are encouraged and they're required to have such good oral hygiene. Once the braces are taken off, the habit is there. You don't have to try and push that habit in. That habit's been reinforced. So once it's there and you keep it there, it's much easier.
Thinking of my own kids, when they were younger, that finishing is so important, isn't it? What I used to say to them is upstairs, downstairs. So don't forget, I think whatever you can come up with. I loved the song, but
whether it's the 2 circles or the upstairs, downstairs, biting surfaces.
And then finishing it for them.
There's a great resource that has been developed actually by one of our colleagues in Dublin. It's called brushmyteeth.ie, and it has a range of videos. Now, it's designed for people who need additional assistance, but there's a video in there for everybody. And one of the techniques he talks about is using 2 toothbrushes. So they have their toothbrush, and it can be pink with whatever, and you have your toothbrush, so that they use theirs and you come in then and finish with yours. And it just means that you're building the positive.
Yeah.
the whole time. Once the habit's there, it's much easier to maintain.
Yeah. Actually, one of the other things I found as well, we were great kind of Monday to Friday, but then there's no school on Saturday or Sunday, then it's remembering to...
Yep. Well, it's amazing how many habits get dropped at the weekend because there's so many other things. Everybody's living a busy life now. I think the pace of life is so much faster and there's so many other things to be incorporated. But there's always a bedtime.
Yeah. And routine is so important, isn't it? For them? Yeah.
There's always a bedtime.
And we talked about toothpaste, but in terms of toothpaste for children, like for example, should children under 2 use fluoride toothpaste?
With the 0 to 2s, if you think about them, they're the toddlers. They swallow everything. Everything goes in the mouth. So at the moment, unless you've been told because of their individual risk that they need to have something like that, and it would be very uncommon that we would recommend fluoride toothpaste for under 2s, then the recommendation is no, we don't use fluoride toothpaste on under 2s. For over 2s, we tend to recommend toothpaste on a risk basis. So you will, if you turn the box over, you'll see that most toothpastes will have a declaration of how many parts per million. Most adult toothpaste come in at about 1400 or 1450 parts per million. But you have to remember, it's a pea-size amount. We're not actually asking people to swallow it. So it's about the concentration on the teeth that's doing the work. There are children's toothpastes that actually come in lower than that. We're currently reviewing the advice as to what's the general advice we would give. We have toothpastes that go up to 5,000 parts per million, depending on your risk. So some kids will be recommended to use a 1,400 or the middle one, which is 2,800 parts per million, depending on the risk to either their oral health or their general health. So if you're somebody with underlying conditions, don't be surprised if you're recommended to use those higher fluoride toothpastes. But the technique is all the same. Pea-size amount applied to the teeth. Let the ingredient do its work. It's not for eating.
Okay. For parents looking for toothpaste in the supermarket, for example, you know the way some are branded milk for milk teeth, or does that matter? Or
what you'll find is turn it over.
Okay.
It's about the concentration of fluoride.
Okay, so that's what you look for.
So that's what you're looking for, absolutely. And if you've been recommended that you need to use an adult toothpaste for your child because of whatever risk that they have, whether it is a food-related risk or a health-related risk, then you've got a wall of 1,400 part per million toothpaste to choose from.
Right, okay. And then flossing for kids as well. Would you recommend flossing for children?
It depends on actually how their teeth are overlapped. I would be building the toothbrushing habit first.
Okay.
If you've got a child, when the baby teeth start to fall out and the adult teeth start to come in, you can have quite uneven appearances. And as they grow, those uneven appearances disappear. If you've got overlapping teeth, they are what we call a food trap. And some parents will find that floss is the only way to clean that food trap. And it's just because of the shape and the angulation of those teeth at the time. There's nothing wrong with flossing. But the key habit is the toothbrushing habit.
Right. Okay.
That's the one that we really want to get kids into. And then whatever tool you need to get into those corners, whether it is the thread of floss, one of the little flossettes, or a single tufted toothbrush to clear out any of those uneven spaces where food tends to lodge. And it's a conversation to have with your dentist. You know, do I have to floss? They'll look at the risk and they'll look at what shape you have and what corners you're trying to get around. But it's actually very hard to floss somebody else's teeth.
Yeah, especially for children. Yeah, if you don't want to damage it or loosen it even.
Yeah, and you don't want to discourage them away from oral hygiene habits.
Yeah.
So if they are really having difficulty with you trying to floss an area, you may lose the cooperation for the other habits you're trying to build as well.
Okay.
I'd suggest the single tufted brush is probably a better tool for those awkward areas.
Okay.
And flossing is more related to gum diseases, which are more common in adults than children.
Okay. And what about mouthwash?
Again, coming back to what do you want the mouthwash to do? Yeah. From the vast majority of mouthwashes that you'll see on the supermarket shelf, you turn them over to see the list of ingredients. And whether you're using a mouthwash that has a fluoride in it because it's related to preventing decay, or whether it is a chlorhexidine or other product that is trying to reduce your bacterial count for gum disease management. The way that a mouthwash works is that you take a mouthful of it and you have to swish it around your mouth. And if you're trying to swish it into all the corners, you've got to put a bit of power behind it. If you're going to use a fluoride toothpaste that has 1,450 parts per million and your mouthwash has less than that, then I'd suggest you don't need to be using that mouthwash at the same time as brushing your teeth. because you're only going to reduce the concentration. But frequently the recommendation is about using a mouthwash to help reduce gum disease. And that's a chlorhexidine mouthwash. And it might be used at times other than toothbrushing. So there's different ways of using mouthwashes. The oral hygiene habits we want to build is toothbrushing and flossing, and a mouthwash if it's going to add to the preventive strategy.
Yeah.
It doesn't always do that.
Yeah. And actually some of the mouthwashes that you see advertised as well, it's about that glistening smile. I mean, actually that's one thing I wanted to talk to you about, was around the amount of products you see online. And looking at my Instagram feed, I keep getting this recurring thing for, it's like a Tipex substance for whiter teeth, and I was thinking that can't be good for you. But we're constantly being fed this perfect smile or these glistening white teeth message.
There's a huge amount of social media dedicated to the shiny white, the very straight white. And there's a lot of different ways that you can achieve that shiny white smile. I want people to actually choose the healthy way of holding their own teeth so that they're actually holding what has been designed for them and they're actually going to have it lifelong. A lot of the products that you see online are designed to create the whiteness, whereas we want people to create the healthy, and then there's no problem looking at maintaining that white, clean look. If you're going to use things like bleaching products, I think it's really important that you discuss with your dentist how to do that in a healthy way, because you are talking about an ingredient, and I come back again to the ingredients all the time. You're talking about an ingredient that is designed to bleach. So it has to have some chemistry in there that's actually going to remove either the colouring or the food products or the deposits that are on your teeth. And that has to have some level of impact on the actual surface of your tooth. Most of them are designed to be used within a certain frequency and they have a certain concentration of the chemistry in there. But you do need to understand that if you have teeth that have restorations, fillings, if you've got gum margins that are a little bit sensitive, maybe that product is not going to do what you need it to do, and it might actually damage or leave you with pain or sensitivity because it's really not the product for your particular scenario.
Okay.
And that's really important for people to understand is your dentist wants you to have a white, healthy smile. The white you see on social media isn't necessarily available in nature. Some levels of assistance are fine. Other levels of assistance are not recommended. And some of it is what I call manufactured. So we have a huge range of dental materials. We use porcelains, we use resins, we use metals, we use porcelain fused to metals. All of them are designed to actually give us the range of materials we need to do to rebuild a smile that's damaged.
Right.
But it is rebuilding a smile. We're trying to pull people back into prevent the damage as much as possible. And then when you do need the dentist to rebuild a smile, we have got lots of tools in our toolbox to help do that.
Right. That's a lovely way to look at it. I just wanted to move on now to eating well now and managing the amount of sugar, the impact of sugar on your teeth, and ask you about that.
I don't know if you've remembered the poem that Pam Ayres had, and she talks about the impact of sugar on our teeth. It's a classic poem. Our relationship with food is very complex.
Yeah.
It's cultural, it's taste, it's texture, but sugar is the one ingredient that has a significant impact on oral health because it is the foodstuff that the bacteria that normally live in your mouth love to eat. So they use it as their food supply. And what they do is they create an acid environment. Now, again, saliva, that liquid that goes around your mouth and that you get more of it as you eat, is a hugely important part of the protective systems that you have in your mouth. It's a fascinating topic, is saliva in general, but it helps digest food. It helps move food around the mouth, but it also has systems and buffering in place that help reduce that acid and bring you back into a positive pH. So every time you eat, you will have what we call an acid attack.
Yeah.
As long as those acid attacks are not too frequent and you get back into that neutral, your saliva is helping protect your teeth. It's when we have too much sugar and the sugar is there for too long, we start to see the negative impact that sugar can have on your mouth.
Okay.
And it's that acid attack that we talk about. And that's why we talk with kids, we talk about the sugar clock. So you can show them how many times a day. And sometimes your dentist will ask you to have a food diary and keep it for a few days to see what kind of eating habits you have.
Okay.
So it's eating and drinking habits are important. If you look at safe food, they have the food pyramids. That's how we try to teach people about the healthier options for food. And it really works for oral health as well.
Yeah.
So our biscuits and our really heavy sugar items are on the top shelf, so they shouldn't be had too frequently. And a lot of the food pyramids that are there will suggest for different age ranges how many meals and how many snacks. So if you take a teenager, it's 3 meals, 2 or 3 snacks, depending on their age range.
Yeah.
So that's 6 food events in the day. And your saliva will be able to help with that. If we're having more sugar in drinks, and that's why we have that whole conversation we had about the sugar tax on drinks, if sugar is around the mouth for longer periods of time, that's when the damage occurs.
Okay.
So in between your meals, water or milk, and we do mean just water.
Yeah.
You go to that water aisle, turn around the bottle and see, does it say carbohydrates 0, of which sugar's 0?
Yeah.
A flavoured version of water that has that 0 is perfectly fine.
Okay.
Once that 0 goes up, you're feeding the bacteria in your mouth. That's one to watch, because there's a lot more variety in waters than just the stuff that comes out of the tap, which in Ireland is perfectly drinkable.
And then finally, I just wanted to ask you about, there's a new EU directive, I think it came out on January 1st, about dental amalgam, and it's no longer being used in most treatments in Ireland. Is that right? Except in exceptional cases?
Yeah. This is going to be a big change in Ireland, because we have quite a history of using those silver fillings,
Yeah.
particularly in back teeth. Would you believe that silver amalgam is around since the 1830s?
Really? Yeah. Wow.
It has been a really good material to restore teeth that have had damage from decay, but we're now phasing it out.
Yeah. And why is it being phased out?
One of the ingredients in silver fillings is mercury.
Right.
And a decision has been taken globally to reduce the environmental impact of mercury because it gets into food chains. Dental amalgam is only a small portion of the use of mercury, but because it's in those silver amalgam fillings, we're now phasing those out. We have huge numbers of options. But the option that I'm hoping to encourage people to use is the option of prevention.
Okay.
Where you're actually making those healthy choices to reduce your need for fillings.
Yeah.
If you need a filling, most patients now will prefer to have a white one. And the smaller the filling you have, the more options you have. So that's why we're encouraging people to do that preventive pathway and to try and make those healthier choices so that they won't be relying on the silver fillings that some of us have.
Okay.
You know, I'm the proud owner of one.
Oh, me too.
And I will be leaving it there until, for some reason, I need to actually replace it. That's the other message that people need to understand.
Yeah.
There's nothing wrong with leaving my silver fillings there.
Yeah.
When they need to be replaced because they're no longer doing the work they're supposed to be doing, then I'll talk with my dentist about what's the best option for them. But we have a whole range of new materials that weren't there when I was a kid, and I'll be able to choose from one of those materials if it's suitable for that space.
Okay. But just to be clear for people, there's no reason for people with existing amalgam fillings to have them removed?
Absolutely not. Absolutely not. It's expensive. Every time you replace a filling, you lose a little bit more of your own tooth.
Yeah.
So it's important to reduce that, and leaving your silver fillings there until they actually need to be replaced is really important.
We're coming to the end of the podcast now, and you've given us some great advice there. Thanks very much. But I was just going to ask you if you have any final tips that you'd like to share.
My hope is that people will choose to take the oral health message, and it's the brushing twice a day, fluoride toothpaste, and have a look at those food pyramids. They're a great way to introduce talking to your kids or having a look at yourself and seeing, how am I doing on my food pyramids? Because the messages that they have really will give you the message of positive oral health as well.
Yeah.
So they work really well for the food-related part of oral health. Toothbrushing twice a day, and if you need to, then flossing.
That's great. I'd like to thank Dr. Anne O'Neill for joining me today. To all our listeners, thank you for your continued support, and please share this episode. If you'd like more information about HSE Health and Wellbeing, follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for our e-zine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.